But if your doctor has done a pelvic exam before, hopefully they've done it before now, then they should have been able to tell you that ahead of time. And all it is when they're doing your initial exam, when they did your very first initial pap smear and everything, they take their hands and they see if they can touch your sacrum, and then they see if they can touch your spines on each side and your pelvis bone. So they know the whole circumference of your pelvis. And it should be, they have a number they break your water and your baby's floating somewhere up in like -3, -4. Remember how we talked about station, -3, -4? That's kind of floating up above the pelvis. And they break that water. Sometimes if that suction is just enough to pull that cord down into that position. So if they're going to break your water, you need to make sure that your baby's head is low enough. You can ask, is my baby's head engaged? What are the chances of having a prolapsed cord? And they may look at you like, you're not supposed to know that. But that's something to consider. If they're going to break your water, and I've had it done where your water was broken artificially. It didn't break on its own because it would help labor. But there's a point when it's safe and there's a point when it's not safe. So those are the kind of things to consider. But if for some reason your water breaks on its own and that cord does slip out and you're at home, that's the situation we talked about where you get on your hands and knees, you put your bustle as high in the air as you can, and you call emergency right away. 911, you tell them exactly what's going on. And then you'll be in that position all the way to the hospital for emergency C-section. And that's the kind of case where, you don't have to ask the benefits and the risks. If that happens, then you just need a C-section to get your baby out. And but that, again, that happens so rarely that it's not something to worry about. But I do want to make you aware of it. Really doesn't happen very often. So all of those things, how many of those were really life-threatening immediately? One. And so when people ask, well, what if something happens? There's a lot of things that can happen that you'll still be just fine. And there's only just a few things that can happen that are really scary, life and death. But those, again, they happen so rarely. It's like plane crashes. How often does a plane crash? Not very often, right? Do you fly? Does anybody not fly because they're scared of a plane crash? No, you fly. You know something could happen, but you have confidence that it probably won't. The odds are in your favor that it probably won't. And so you fly. And when we talk about having babies, there is that potential that if something really, really bad happens, that it's cataclysmic, life and death kind of things. But they happen so rarely that people still have babies. You're not going to stop having babies because you're afraid of something really, really bad happening. Because chances are it probably won't. And then I have another one in there past that. I think I gave it to you. Did I give you the what if sheet? It says what if at the top. Maybe I didn't. Maybe I just gave you the one. This one was, okay, maybe I just gave you the one. But I will mention, there's some other things on it
situations they say massage. You
Mhm.
push hard and use massage, and
Massage
it's
the
like
fundus.
pushing pressure into it
Right,
rather
right.
than the stuff.
Yeah, that's one of the things they do. But if you're in the hospital, they're gonna give you that Pitocin right away too. Um, they want the it to stop. But yeah, yeah, that's a if you're in a home situation especially, that would be a good thing to know about just massaging the fundus. And that's something that you're going to be doing for the several days after the baby's born, is to keep your uterus contracting. Now, if you're nursing, if you plan on breastfeeding, your baby suckling is going to be able to do that. It's going to start contracting your uterus. But even so, you want to make sure that your uterus is shrinking. So you're going to be massaging the top of your uterus to make sure that it's shrinking. Yeah, you're right. Again, another thing is retained placenta. If the placenta doesn't come out within the first 30 minutes to an hour, then they're going to start considering, again, Pitocin, and then they'll massaging the fundus, and then they're going to have some other methods that they're going to consider trying to do to get the placenta out. And again, you just go through and you ask the benefits and the risks and all those things. One thing, and then if the baby comes out and the baby's not breathing, they can do infant CPR. They do the resuscitation just like any EMS would do on anybody. And then there's one other thing that's really the worst thing that could happen. The worst possible thing that could happen is the placenta detaches from the uterine wall before the baby's born. And that's something where if you ever feel a sharp pain that's not contracting your uterus, but it's just a localized sharp pain that won't go away, and it's not in spurts, it's just that localized sharp pain. That's something that you want to go in and just see and check. Go ahead and call your healthcare provider and let them know. And then if they think it might be a placenta abruption, is what it's called, or then they can talk to you about that. But that's something that, again, it's like that cataclysmic worst possible scenario that rarely ever happens. I think it's like one in no, 6 out of 1,000 births. So it's like less than 1%. And it usually happens, if it happens before 37 weeks gestation. And again, it's in somebody who's not healthy and is having problems with their baby's growth. So it's not something that's without symptoms and signs ahead of time. It's something that your doctor can look for as far as your health. And if you're healthy, like you guys are, it's something you shouldn't have to worry about at all. So I gave you some things that were kind of normal, and just a couple things that were kind of scary, right? I mean, most of those things, they're not really scary. And with our situation nowadays, with our technology and our medicine, most of those things can be dealt with without loss of mommy or loss of baby. And so now that you know, okay, these are the things that could happen, you can kind of rationalize a little better. I think it's always more helpful to know the what ifs than to just imagine things, or to not know. It's easier when you know the things that you're scared of, I guess. So any questions about any of those situations? Okay. Well, now that I've told you the what could happen, we're going to go back and talk about the interventions that could happen. And so, how I'm going to do this, we're going to talk about, we're going to go back to these sheets that are kind of sideways, and they have the brain on them. They have all these BRAIN, and these, I already got it together for you, so that if you read through these, you're down, but then your pain gets more, so maybe they give you a little bit more epidural. So you're going to get another 2 parts, let's say, because they're going to do something else. What do we got now? Okay, so we're still good. Baby's still doing fine. But you can see how quickly it escalates. Every time you get another thing, you have another risk. And every time you get another risk, you get another treatment and you get another risk. And those risks can quickly add up to C-section really quickly. So I'm trying.
Snowballs.
It snowballs. It really does. And so I'm not, you know, to let you know that really the risks at the beginning are very small. But every time you add something to it, you have those more risks factors. And so those are things to consider. Now sometimes, again, the benefits outweigh the risks. And so you have to look at each decision individually. But you can kind of see how fast it gets out of control. And this is just a silly illustration, but I just wanted you to see how fast it can go. So let's look at some of these benefits and the risks. And we're not going to finish this today, but we're going to finish this tomorrow. Not tomorrow. Next week we'll go ahead, we'll finish this, and then we'll talk about birth plans, we'll talk about some of the options, and we'll talk about circumcision, if you guys are interested in knowing about those things. So let's start out with some of these things as far as IV. That's the first one on there. So the first question you're going to ask is benefits. What are the benefits to an IV? Anyone want to take a peek? It can help with dehydration, and it can really help if it's been a long labor and mom's getting really tired. Then an IV might give her some extra energy. And it allows quick administration of medicines in case of emergencies. What are the risks? Well, you can imagine being tied to a pole and trying to get up and move around. Remember, what are your responsibilities in labor? Your 3 responsibilities. Relax, yes. Keep the body empty and stay nourished, yes, nutrition. Now, if you have an IV, they're not going to be letting you drink fluids because they're going to say, oh, you have an IV. So you don't have to worry about that. But how difficult is it going to be to relax and empty your bladder when you're tethered to a pole? Not very easily. Especially when you have that, that cord going around. And it's not, if you have to have it, it's not that big a deal. But if you can avoid it, then it's going to make it easier for you to get up and down and move around. And if you want to try it sometime, get a coat hanger and tie a piece of string to your arm and string to the coat hanger and see how you like walking around the house with that. It's not very easy. So what are the alternatives? Eating, drinking, and having one of those Heplocks. The Heplock is the insertion. They have the tube inside you. And so if you need to get medications quickly, all they have to do is plug it in. But you still have that freedom of movement, and you have that freedom to drink water and stay nourished yourself. Another risk, I'm not sure if it's on here, but you can read through these. There's a lot of risks here, so I'm not going to go over all of them. But you can read through these. Another risk is just having too much fluid. If you have too much fluid, and I've seen this happen a lot of times with moms in hospitals, is their face gets really puffy, and their feet get really puffy, and their hands get really puffy, and their baby's really puffy. The baby comes out puffy. And so it can kind of cause some concern because your baby has excess water weight when they're born. And I know you don't want to push out any bigger baby than you have to. So right after the baby's born, normally babies lose weight right after they're born, right? It's normal for babies to lose weight right after they're born. I know that. But if a baby has that artificial water weight and they lose a lot of weight, your pediatrician, your doctors are going to be concerned. And sometimes it's just because they had excess water weight from the IVs. And then, so you can read through those again and make that decision, and then talk to your doctor about it. Say, can I have a Heplock? Is there any reason why I can't have a Heplock? And discuss those things. And then continuous electronic field monitoring. Again, this is one of those things that's just kind of uncomfortable in labor. And what they have is these straps that go around, and you have one here for your contractions, and you have another strap here for the baby's heart rate. And they're going to be monitoring those, usually continually in most hospitals. And hopefully you have wireless ones where you don't have to, otherwise you're going to be, again, connected to something with these long wires. the one where they take this little bitty hook, it's just little itty bitty, and they take it and they put it right in the skin of the baby's head. And then they measure the heartbeat from the baby's head. It's a little more accurate, but your water has to be broken for it to work. And then you have another tube, another cord attached to you, and this one's running out of you and attached to a machine. So that's something to consider. And then lying on back in labor, obviously, that's not something you want to do because you want to be able to move. But there's some, so you can read through those. Restricting movement. you know, there's they just turned her pitocin up another 2 notches. I don't know if you realize that. Those kind of things can be helpful. So yeah, they have to get your consent, but you have to be on guard, especially because she's going to be in a spot. You remember, she's going to be in her labor bubble, and she's not going to be wanting to deal with signing forms and getting all these people around her. So you're going to have to be that first line of the defense between her and the doctors. Now she's going to be able to make the decision ultimately, but you need to be the one that's asking questions because that's not where her head's going to be.
Okay.
So as long as you're on, can discuss these things beforehand, you're on the same